Christine Lawson, 36-year-old mother of Lucy Lawson, age 12. Mother states Lucy is suffering leukemia, epilepsy, and cerebral palsy. Lucy has been diagnosed with these illnesses since an infant, and her mother has taken Lucy to several doctors seeking medical treatment. The physicians ran multiple tests that resulted negative in the many disorders that Christine said Lucy had all her life. So what really is happening to Lucy Lawson? Her mother Christine has been inflicting medical child abuse upon Lucy since she was an infant.
We had a chance to talk to a few students and ask them what they thought medical child abuse was.
Have you ever heard of medical child abuse?
Once or twice. I'm not super familiar with what exactly it is though.
If you could guess what medical child abuse was, what do you think it is?
Maybe like refusing care that the kid needs, or something like not vaccinating your kid, or maybe giving them drugs that they don't need. I don't know.
I think giving people medicine that they might not have to take.
Medical child abuse is a variant of child maltreatment in which the victim is subjected to unnecessary and harmful or potentially harmful medical care at the instigation of a caretaker. The symptoms of medical child abuse are virtually any pediatric illness that can be fabricated and presented in different ways. Some examples include epilepsy that may be misdiagnosed if a caregiver lies about the child having seizures or poisons them with the drug that causes seizures, such as Almazine. Renal disease may be simulated through the addition of blood to the child's urine samples or urine to their blood samples. Medical child abuse is hard to diagnose for many reasons, such as the medical team is used to being lied to by the abuser. Patients may be too young to speak for themselves, or they may have been conditioned to lie. Tips for medical providers in diagnosing medical child abuse are: if doctors find no physical reasons for the symptoms, or if the pattern of physical symptoms may be self-inflicted, then the caregiver should be referred to a psychiatrist or psychologist. After that, the child should be removed and placed into better care, such as kinship care or foster care, while the authorities have the chance to investigate and find a solution.
Now that you know what medical child abuse is, you can be more aware about how illnesses can be fabricated by a caregiver. This is an example of how easy a parent can fake a child's illness. Medical child abuse is not as common as the media portrays it to be. In fact, most cases are misdiagnosed. As a community, we need to look out for warning signs of medical child abuse to stop the maltreatment of children for various conditions.